Hi, good day. My name is Lydia Linasari Sinarta. I'm currently a resident of Obstetric and Gynecology in Medical Faculty of Udayana University in Sanglah Hospital in Denpasar, Bali. And today I would like to bring a presentation about my descriptive research with title Profile of Pregnancy Undergoing Amniocentesis in the SIDIC Fetal Maternal Outpatient Department in Sanglah General Hospital from June 2017 until June 2019. So from the introduction, the congenital anomalies itself is a structural or functional abnormalities that occur during intrauterine life and are identified in the prenatal period at birth or after birth during infancy or childhood. With data from WHO in 2015, around 3,300 neonates die annually in the first 4 weeks of life due to congenital anomaly. And in Indonesia itself, there were 59.3 congenital anomaly in 1,000 births in 1980 until 2001. This is a global health problem and an important causes of mortality and morbidity in children. The factor itself can come from genetic, it can come from socioeconomic, it can come from the environment and the nutritional status of the mother, and getting the infection of the mother and the demographic itself. The chromosomal abnormalities come from 2 points. There is a structural abnormalities and numerical abnormalities. The structural, it can came from deletion, duplication, inversion, translocation. From numerical, we have known that there is a euploidy chromosomal abnormalities and aneuploidy. This is an important screening and a prenatal diagnosis of the amniocentesis, which from the screening itself, we can do it from preconception, periconception, and from screening the neonates itself. From the prenatal diagnosis, we can know the defect from the amniocentesis, from the chorionic fluid sampling, and the fetus blood sample. Amniocentesis itself is a procedure used to get a small sample of amniotic fluid that's run the fetus to diagnose chromosomal abnormalities and congenital defects. The advantages of the amniocentesis is a simple procedure, it's cheap, it can ensure diagnosis of chromosomal abnormalities. The disadvantages, however, there is an infection after we done that, and an abortion if done before the pregnancy of 14 weeks gestational age. In America, they done it 200,000 times in 1 year. What we got from the amniocentesis, we can improve the baby prognosis by intervening in utero. We can prepare the team for the process of birth and baby care, and helping families prepare to care for babies with special needs. It's a surveillance program in Indonesia, the congenital anomaly surveillance program. One of them is happened in Sanglah Hospital. We have a non-SIDIC, which is a Sanglah Integrated Birth Defect Center, which run by the Fetal Maternal Department Division in Sanglah Hospital. What is the problem that we face here that encouraged me to bring this descriptive research is I want to know what is the profile of pregnancy undergoing amniocentesis in the SIDIC Fetal Maternal Outpatient Department in Sanglah Hospital Denpasar during the period 2017 until 2019, and how many chromosomal abnormalities were detected, and what types of chromosomal abnormalities were found in pregnant women undergoing this amniocentesis procedure. And what is the purpose? As I said earlier, I want to know the profile of the pregnancy undergoing amniocentesis and knowing how many chromosomal abnormalities were detected and what type of chromosomal abnormalities were found. The benefit for the from the scientific. It can add information related to pregnancy profile and congenital abnormalities, especially in the field of obstetric. And we found it through amniocentesis examination and adding the knowledge about the profile of congenital abnormality in SIDIC fetal maternal outpatient department. And for public, I want the public understand more about the related characteristic of congenital abnormalities and increasing the public understanding regarding the importance of the antenatal care. We will go to the chapter 2, which is a literature review. The congenital abnormalities is access that access at the time the baby is born, whether detected or not, in the form of structural, functional, and or biochemical abnormalities. As CDC mentioned, it's structural changes that have significant medical, social, and cosmetic effect on patient and require medical intervention. Birth defects are a serious problem because they have short-term and long-term morbidity. The epidemiology in the United States of America in 2015, there are 3% of baby born with a birth defect, around 29 in 1,000 live birth. And the race, Asian race is the highest in America. And according to WHO, the most common birth defect are congenital heart defect, neurotube defect, hemoglobin abnormalities, thalassemia, sickle cell anemia, Down syndrome on trisomy or trisomy 21, and glucose 6-phosphate dehydrogenase deficiency. While in Indonesia, every year we have 59.3 in 1,000 birth defect. We rank in 7 in Southeast Asia, and Indonesia has the highest child mortality rate under 5 years old due to birth defects. And in Sanglah Hospital itself, we have around 2.6% of this birth defect. The classification of congenital abnormalities, we can classify it from etiology, morphology, pathogenesis, time of occurrence, and abnormal category. From the classification of based on etiology, the chromosome, the known abnormalities was chromosome abnormalities, microdeletion, teratogens, new dominant, familial syndrome, familial, its syndromes, is isolated and multiple, and the idiopathic that cannot identify as the definitive causes. Based on morphology or clinical, the isolated is a major single malformation such as spina bifida with clubfoot and hydrocephalus, and multiple means defect more than one major type. Association is malformation more than one type pattern, like Fetal syndrome. Sequences, malformation more than one related type. Minor malformation is insignificant, and there are no visible defect. Based on pathogenesis, we have sequences, pattern, and developmental defects. The sequences malformation related to one another in a sequence that begins with primary malformation, such as spina bifida causes hydrocephalus, and pattern multiple malformation that have a pattern of occurrence, though not a sequences like Fetal syndrome. And developmental defects, congenital malformation caused by developmental abnormalities during embryogenesis. And classification based on time of occurrence, the malformation usually occurs in the embryogenesis process. Destruction in a term of morphology caused by structural changes in part that have the potential for normal development can be caused by vascular disorder, infection, teratogens, and mechanics. And the deformation usually occurs after organogenesis. The classification based on abnormalities category, there is a CNS abnormalities in the ear, cardiovascular, gastrointestinal, genitourinary, musculoskeletal, and chromosomal abnormalities. The risk factor usually increase with the mother age, and multiple gestation, alcohol consumption, smoking more than one pack per daily, and systemic disease like diabetes mellitus and folic acid deficiency and teratogenic substance. The examination of congenital abnormalities, we can do it from preconception, prenatal examination during the first trimester and the second trimester. The preconception examination is identify of family risks to inherited disease, the pedigree chart making, and vaccination against rubella is also recommended in preconception counseling. The prenatal examination in trimester 1 we can do from nuchal translucency and checking the PAPPA, free beta HCG, and early amniocentesis and chorionic villus sampling. While in second trimester we can examine it from the ultrasound, the maternal serum alpha fetal protein, and from amniocentesis or chordosynthesis. The amniocentesis history. From the history of amniocentesis in 1870, first performed and reported by Perkowik, Lamb, and Such in the case of polyhydramnios, and 1915 improved by examination of rhesus disease by Bevis, and 1916 research related to the result of the amniocentesis producer for cell culture as a basis for diagnosis chromosomal abnormalities and enzymes by Lilly. 1970, Butler and Grace reported the largest first amniocentesis examination, and 1980, amniocentesis examination was introduced with the help of ultrasound, so that the examination began to consider more secure. And the indication performed on weeks 15 to 20 gestational age, with the age of mother is more than 35 years, with abnormal marker found on ultrasound, on marker of abnormalities on biochemical examination, and family history of hereditary disease. And how the amniocentesis done? The examination is carried with the ultrasound guidance with needle 20 to 22 gauge for taking amniotic fluid samples, and it can be done by transmembrane or transplacenta. The needle is directed to take 15 to 30 milliliter of amniotic fluid. Target position in the middle of the cross-section of the ultrasound layer with vertical probe. The needle is inserted from the lateral probe as far as 3 centimeter with an angle of 45 degrees. Intake of fluid by inspiration or a vacuum device, and ensure throughout the procedure the needle must be seen in ultrasound visualization. And the complication that can happen from amniocentesis is the abortion is around 0.6%, amniotic leakage, infection, fetal and maternal injury due to needle puncture, ruptured membranes, and club foot because of the reduce of the amniotic fluid itself. The risk factor, the pregnant women who can undergo this amniocentesis is they who pregnant with multiparity, have vaginal infection, miscarriage story more than 3 times, retrochorionic hematome, miliary malformation, uterine fibroids, and history of maternal bleeding. The prognosis in 2019, there were 2.68 million child deaths due to congenital abnormalities worldwide. The chromosome abnormalities in the form of aneuploidy cause more than 50% of abortion in the first trimester, around 20% in the second trimester, and result in range 6 until 8% of baby stillbirth and death in early childhood. The multidiscipline. It is expected to have a better prognosis with multidisciplinary preparation and intervention to face this abnormal baby that have birth defect. A number of clinicians with various background of expertise are needed in a multidisciplinary team handling congenital abnormalities. Parental fear and confusion in the face of diagnosis, preparation for delivery, and selection of advanced intrauterine and extrauterine management require integrated management. And fortunately, here in Sanglah Hospital, we have a SIDIC, which stands from Sanglah Birth Defect Integrated Center, which is one of the integrated service in Indonesia, centered in Sanglah Hospital. We focus on congenital abnormalities by coordinating various department of service to create an integrated and leading service in managing congenital disorder effectively and efficiently. Service include prenatal and natal at the fetal maternal outpatient department and postnatal service at the growth and development outpatient department in pediatric. The pregnant woman with fetus is suspected to have having congenital abnormalities are screened in advance, and then we preparing for the SIDIC forum to make this case a conference so that we can discuss the cases comprehensively. We go to chapter 3, which is the research methods. The design is the descriptive retrospective study with location and time in Sanglah Hospital from June 2017 until June 2019. Why June 2017? Because it is the first time that we did the amniocentesis, and June 2019, 2 years is good enough to evaluate the progress, the successful of amniocentesis in revealing the chromosomal abnormalities. And the target population is pregnant woman with a diagnosis of congenital abnormality in the fetus. The sample was taken from secondary data, namely from the medical records of all pregnant women with a diagnosis of fetal congenital abnormalities who came to Sanglah Birth Defect Integrated Center of Fetal Maternal Outpatient Department in Sanglah Hospital. The material and research work, as I said earlier, the data taken from Sanglah Birth Defect Integrated Center from June 2017 until June 2019, and medical records of pregnant women undergoing amniocentesis procedure at the Sanglah at the SIDIC, and data taken were distributed based on gestational age, parental age, history of period, and maternal abortion, identification of risks of the disease in the first degree offspring, exposure to drugs during preconception and pregnancy. The definition of operation variable, I will not explain this very detailed, just brief. Congenital abnormality are abnormalities that exist when the baby is born. Amniocentesis is a medical procedure for the prenatal diagnosis of chromosomal abnormalities in which a small amount of amniotic fluid is taken, then the fetal DNA is examined for genetic abnormalities. For the gestational age is the age of the womb calculated from the first day of the last menstruation listed in the patient medical record. Age is the maternal age, indication, and period. And abortion is the amount of conceptual release before the fetus is able to live outside the womb. This is risk disinfection, identification, first degree offspring, exposure to drugs, and consumption of folic acid is which is a supplement in the form of a single or multivitamin taken by the mother. The flow for the research: first we have the cases from the SIDIC register, and then we take the patient medical record at the medical record center, and we done collection, the collected data, and we done data tabulation, and then we made the research report. The result in this discussion, we got total of 32 patients. There are 30 patients who underwent amniocentesis and 2 patients who underwent amniocentesis and amnioreduction. The characteristics of the participants: from the mother age, we have range of mother 20 to 30 years, mostly that did the amniocentesis, with a total number of 13, and the father age is also the same, most from a range of 26 until 30 years. We got 10 patients. In a study assessing congenital abnormalities in Saudi Arabia, have similar result. The average maternal age is 29 years, while a contrast research came from Zhang. The risk of chromosomal abnormalities increases 6.64 times. The risk of trisomy 21 increased 6.83 times, and the risk of trisomy 18 also increased in mother age over 35 years compared to women aged 29 and 25 to 29 years. This has happened probably because of in Indonesia the reproductive age is range in 26 until 30 years. So they come to our hospital to do the antenatal care, while maybe in Zhang, where Zhang did the research, the reproductive age mostly in over 35 years. So they got 35 years a result that have more chromosomal abnormalities. Another study said that the age under 20 years has higher incidence when compared to reproductive age that is equal to 3.2%. However, the study concluded that the major congenital abnormality actually reduced the risk along with an increase in maternal age to the age of 40 years, after which the risk increases again. The difference between this study and other studies cannot be concluded because the study does not include population without birth defects, so that their relative risk cannot be calculated. The study only assessed population at risk of birth defects undergoing amniocentesis examination. And from the ethnic, because we done this in Bali, so most of the patient is originally from Bali, and the parity from 0 parity to 2 parities, we got the same result. And the gestational age that done this amniocentesis, it's in second trimester, which is 16 patient. According to the guidelines, amniocentesis examination were carried out by 15 to 20 weeks, and a meta-analysis study concluded that amniocentesis in early pregnancy compared to the second trimester would increase the risk of intrauterine infant death, and other risks include spontaneously abortion, congenital anomalies such as talipes. In the study, there were no complications in the form of IUFD or spontaneous abortion. And post-amniocentesis karyotyping result, we have 25. Yeah. For 11 patients without chromosomal abnormality with chromosome 46 and XX, and 14 patients with 46 and XY chromosome. And we got from the 32 patient, we got 7 patients with chromosomal abnormalities, with trisomy 13, 1 patient, trisomy 18, 4 patient, tetraploid 1 patient, and deletion 1 patient. The weakness of amniocentesis is that it cannot detect abnormality caused by abnormalities in DNA. A congenital anomaly surveillance study in Europe state that all of the cases of chromosomal abnormalities, almost 75% of the cases are trisomy 21, 18, and 13. And in this study, we found that the highest incidence were caused by trisomy 18. What is the type of congenital abnormality based on ultrasound examination? We got from head abnormalities was mostly 9 patients. Head or central nervous system disorder are the most common type of disorder in the classification of congenital abnormalities. And this is correlated with research from Onyambu et al. In Kenya, who concluded that head abnormalities were the most congenital anomaly found from ultrasound examination. This is possible because the central nervous system abnormalities can be assessed from the first trimester, especially in extreme cases such as an anencephaly, whereas other system abnormalities will be more easily detected in the second and third trimester. Also, the sensitivity of ultrasound examination for the assessment of congenital anomalies of the central nervous system is best, reached 88%. Whereas for the sensitivity of GI tract abnormality is 54%, the musculoskeletal abnormality is 37%, and cardiovascular 28%, and cleft and palate 18%, 18%. And the congenital anomaly detects at birth. We found the hydrocephalus 3 patient. Yeah. And the profile of similarity between amniocentesis examination, ultrasound, and birth abnormalities from the 7 patient with abnormal chromosome. The first patient was in 31 weeks. We found tetraploidy, and from the ultrasound, we found short femur and short humerus. And the postnatal, after the baby birth, we done the termination, and we found the same thing. The second patient is done the 26 weeks gestational age. We found trisomy 13, and we found this all ultrasound examination and found this defect, and patient born and died. And 20 weeks gestational age, we found trisomy 18 with GI tract disorder, same, fortunately alive. And 31 weeks trisomy 18 with labiopalatosisis and atrogynophosis, same, unfortunately died. 27 weeks trisomy 18, CTEV and micronexia, same, and died. 28 weeks, done in 28 weeks amniocentesis, found trisomy 18, we found cardiomegaly, same, and baby died. And 20 weeks, we found dilation in arm P13 and P15. From your ultrasound, we found a follicle, and patient still alive. And the similarity between amniocentesis ultrasound and birth abnormalities, from we found ultrasound abnormalities with chromosomal abnormalities and with congenital abnormalities. There were 7 patients, and ultrasound abnormalities without chromosomal abnormalities and with congenital abnormalities, it's 23 patients, and ultrasound abnormalities without chromosomal abnormalities and without congenital abnormalities were 2 patients. And the baby outcome, alive is 17 patients, termination 2 patients, and died 13 patients. Of the 30 babies who died, the majority had congenital abnormality in cardiovascular system. Based on research from Get et al., who examined the contribution of congenital abnormalities to neonatal mortality in Malta, the congenital abnormalities accounted for 36.7% of neonatal deaths, whereas the research conducted by Ronquencio et al., who examine the characteristics of fetal and neonatal death due to congenital abnormalities in Colombia, found that most common congenital abnormalities resulting in death were cardiovascular abnormalities, CNS, and the chromosomal abnormalities. The gender of the baby, mostly male, 16 patient, female, 14 patient, and termination, 2 patient. Based on research from AHO, who examined the outcomes of infants with congenital abnormalities in Nigeria, they found 53.7% were male. The conclusion, the first one, is the incidence of chromosomal abnormality based on the analysis of amniocentesis sample in patient undergoing amniocentesis examination at our SIDIC was 21.8%. The profile of chromosomal abnormality based on the analysis of the most amniocentesis sample is trisomy 18, 13, tetraploidy, and deletion. The most common abnormality based on ultrasound examination are CNS, cardiovascular, and gastrointestinal. The baby outcome was 53.1% live babies, 40.6% unfortunately die babies, and 6.3% termination. The most sexes of babies who suffer from abnormalities are male 50%, and then female around 43%. It can be concluded that the amniocentesis examination is a gold standard examination in assessing the presence of chromosomal abnormality that cause various birth defects. The best tests are done over 15 weeks gestational age to increase the safety and of the baby outcome. And the suggestion from the study are need more further study related to amniocentesis by seeing all patients with congenital anomalies and assessing various prenatal examination that have been carried out to determine the sensitivity, specificity, positive predictive value, and negative as well as also false positive and negative to prove that the amniocentesis examination is a simple examination recommended in assessing abnormalities. Thank you and have a good day.